of our fight against the third wave of COVID-19. With a stable supply of vaccines, we continue to deliver more shots in arms. To date, over 5.5 million doses of the COVID-19 vaccine have been administered, and 43% of Ontario adults have received their first dose. Thank you to our healthcare workers, public health units, and many other partners whose hard work has helped us come this far. This week, we ramped up our rollout of COVID-19 vaccines to support our most at-risk communities, allocating 50% of this week's vaccine shipment to hotspot communities. To support this, on Monday, we opened up our provincial booking system to individuals 18 years of age and over in hotspots. The demand has been unprecedented, and on Monday alone, we saw over 533,000 appointments booked through the provincial system. Tomorrow, we will further expand eligibility to book an appointment, including to individuals aged 50 and over across the province, individuals with high-risk health conditions, and Group 1 of workers who cannot work from home, such as food manufacturing and distribution, agriculture and farm workers, elementary and secondary school workers, police, firefighters, and emergency medical service workers. As we receive more vaccines, we will continue to make it easier than ever to get vaccinated in our hardest-hit communities. Starting later this week, up to 60 pharmacies will begin to offer the Moderna vaccine in Durham, Hamilton, Ottawa, Windsor-Essex, and York Region's hotspot areas to individuals aged 18 and over. Further expansion of vaccines in pharmacies will continue throughout the month. Thanks to the many Ontarians who continue to sign up to receive the vaccine as soon as it's their turn. We expect to administer first doses to 65% of Ontarians aged 18 and over by the end of May, nearly 7.9 million Ontarians. The light at the end of the tunnel grows brighter with every vaccine administered, and together we can stop the spread of COVID-19. In the meantime, until most people are fully vaccinated, please continue to follow the public health measures that we know work. Thank you, and I'd now like to hand it over to the Solicitor General.
Thank you, Minister Elliott. We are continuing to take steps to expand the province's immunization rollout, and we remain determined to get vaccines distributed to as many people as possible in areas where COVID-19 and its variants are spreading most rapidly. That is why today we are announcing the launch of new mobile vaccine units to help us quickly reach small to medium-sized workplaces in areas where the need is greatest. Beginning Friday, an initial deployment of up to 5 mobile units will be launched in Toronto, York, and Peel regions to reach businesses that have employees who cannot work from home and have a history or risk of outbreaks. In addition to this initial launch, more mobile units will continue to be added over the next several weeks. These will be equipped with the necessary resources to provide an easy and seamless process for workers to be vaccinated as quickly as possible in priority hotspots. We also continue to work with prospective employers in areas where workplace vaccination clinics can have the greatest impact to help stop the spread of COVID-19 and protect our communities. These employer-led vaccination clinics have been completed or are underway at Amazon, Maple Lodge Farms, and Maple Leaf Foods. Additional ones will also be operationalized at other large employers in Peel region, including Loblaws, Walmart, Magna, Air Canada, Purolator, and HelloFresh. In addition, the Ontario Food Terminal in Toronto, the largest wholesale fruit and produce distribution centre in Canada, will operate a workplace vaccination site starting May 10th. This growing number of vaccination sites is contributing to our collective efforts by protecting workers and expanding access to vaccines in residents in high-risk communities. While these are encouraging steps, we must continue to do all we can to save lives and reduce hospitalizations by staying home and following public health measures. By working together to stop the spread of COVID-19, we can keep our loved ones and our community safe. Thank you.
We'll go to the phone line for questions. As a reminder, it's one question and one follow-up. Operator, first question, please.
Your first question comes from Randy Rath with CHCH TV. Please go ahead.
Hi, Ministers. Thanks for taking my question. I'm wondering if you can give me some more information about the Moderna rollout in pharmacies in Hamilton. I believe, Minister Elliott, that you said it's going to start on Friday. Can you tell me how many pharmacies we're talking about and how many doses?
Okay. I think I will refer that to Minister Jones, if you don't mind. Thank you.
Thanks, Randy. I don't know the specific number in Hamilton. I cannot recall, but we will definitely get that for you. In terms of the specifics of each individual pharmacy will only have one type. So if you're a pharmacy that is currently offering Pfizer, then you will continue with Pfizer. We don't want to make it additionally challenging for the individuals who are administering the vaccine. So if you're a Pfizer pharmacy or if you're a Moderna pharmacy. And as I say, my apologies, I will get the numbers to you exactly for Hamilton.
Follow-up?
Yeah, okay, no problem. Thank you. I'm also wondering about the immunization of migrant workers at the airport. What has the uptake been on that? Are you finding vaccine hesitancy among certain groups, or is it being taken up well?
Yeah, it's a good question. When we started the vaccination, offering it at Pearson, when migrant farm workers, temporary foreign workers arrived on Ontario soils, there was a little vaccine hesitancy in certain groups, but frankly, looking into it more deeply, in some cases it was just because it was a very long day of travel. So when they actually went to their place of business, the farm, they actually asked for the vaccination at that point. So we have seen it be very successful, and for those individuals who wish to have it when they arrive in their public health unit at their farm, then we're also notifying and making sure that the public health units are aware of new temporary foreign workers who have arrived. So it's actually been a really successful model. Yes, we saw some vaccine competency, but I think it was frankly more to do with how long the travel day was than actual concern about the vaccine itself. Thank you.
Next question.
Your next question comes from Mike Crawley with CBC. Please go ahead.
Hi, Minister Elliott. In the tech briefing that we received, there's barely any mention of family doctors in the vaccine rollout. Lots of stuff about pharmacists. Why is it that Ontario hasn't given or isn't giving family doctors a bigger role? Is it because pharmacists are able to provide the vaccinations at a cheaper price, or do they bill OHIP less than family doctors do? I just don't understand why family doctors have not been given a bigger role in the vaccine rollout.
Actually, thank you for the question, Mike. Family doctors play a really important role in the vaccine rollout, especially for patients that may have pre-existing health conditions that want to speak to the family doctor before they receive a vaccination to know whether it's safe for them or not. They are also working with ensuring some of their homebound clients who aren't able to get out are able to be vaccinated through either the nurses that are coming into their home, or by some of the paramedics that are doing the vaccine. So they're really performing a key role in sort of making sure that some of our hardest to reach citizens in Ontario are being vaccinated. And we also have seen that there are many family doctors who are volunteering to work at some of the mass vaccination centers as well. So they're serving a dual role and are really performing a very important service in the entire rollout of the vaccine campaign.
Follow-up?
Minister Elliott, I have a question from my colleague Ellen Morrow with the National. They're doing a report about the backlog of medical procedures. As you know, more than 250,000 of them, with some of them being cancer surgeries that have been put off longer than really they ought to have been. What's the province's plan to deal with this backlog once things start to clear from the third wave?
Well, this is a significant concern, and we have, since the beginning of the pandemic, actually performed over 420,000 surgeries that were necessary. Some of these, we call them elective surgeries, but they're not really. Some of them are life-saving surgeries, and if people need those surgeries even now, they will get them. Others we've had to delay because of the number of COVID patients that are being admitted to hospital, but we had a program that we were using before that we're going to reinstitute as soon as we can safely do that. When we see the number of admissions to hospital reducing somewhat, and making sure that we have space in our intensive care units, because we want to make sure that we can perform the cancer and cardiac surgeries on a timely basis, as well as a number of orthopedic surgeries, cataract surgeries, and others. So this is something that we are watching on a daily basis until we can start to perform these surgeries again. We're also taking a look at having a regional wait list for surgeries so that we have all of our hospitals working together. In some cases, there may be some hospitals that may have some space for orthopedic surgeries, while others are regional sources for centers for cardiac surgeries. So our hospitals are working together in a way that I don't think has happened in many, many years. They are really working with each other to share the load of the COVID patients, and I know they're going to work together very collaboratively on working on our surgical backlogs and procedures, which we all have turned our attention to, and we are watching very carefully to see as soon as we can restart those programs.
Next question.
Your next question comes from Dave Woodard with Global News. Please go ahead.
Good afternoon, ministers. Minister Elliott, Health Canada said today that the Pfizer vaccine is good for teens 12 to 15 years of age. But in the vaccine rollout deck, there's nothing to suggest that there are plans to vaccinate anyone under the age of 18 yet. Is that being planned, and when can we expect the province to start vaccinating the 12 to 18 age group?
Absolutely, this is being planned. This is wonderful news. We want to make sure that our young people are protected from COVID as well in the age 12 to 16 age group. We've already been in conversations, discussions with the Minister of Education to make sure that we can start as soon as possible. And fortunately, with the increased supply of vaccines that we're receiving, both Moderna and Pfizer, we wish to start that as soon as possible. So we are actively working through that right now.
Follow up.
Thank you. And Minister Elliott, many medical experts are now saying that achieving herd immunity is going to be a challenge and that it's not likely even possible. So if that is the case and vaccines aren't the only answer, then what, if anything, is being planned to get us to a point where life can be something like normal?
Well, you're right. Herd immunity is going to be much more difficult, especially because of the variants of concern. We have had several of those in Ontario right now, but I think it's really important for everyone to apply for an appointment for a vaccine as soon as you're able to receive one, as soon as it's your turn. But we're going to need to continue to follow the public health measures that we've been following for the last year, making sure that we maintain physical distancing, wearing a mask, and so on. And that will need to continue for a period of time until everyone who wants to receive a vaccination in Ontario does receive one. There is more work to do, but the light at the tunnel is growing brighter, and we will have more to look forward to, but we just need to get the transmission down in our communities to a lower level, and we need to reduce the strain on our hospital care capacity system as well. But we are moving in the right direction.
Next question.
Your next question comes from Jessica Smith with Queen's Park Briefing. Please go ahead.
Hi, thanks so much. This is my question to the Solicitor General. On May 27th of last year, when the Premier was speaking about the military report in the long-term care homes, he said the province was launching a full investigation and the results would be turned over to police. I'm looking for additional details on that investigation. Was your ministry responsible for it? Has it concluded yet? And was any information turned over to police?
So as you know, police investigations would not be reported up through to the Solicitor General. We do not direct or participate in any way in active investigations. So as of now, we have not received any results or information on that particular investigation you're referencing.
Follow up.
Yes, I'm sorry if the question wasn't clear. When the Premier spoke, he suggested that the province itself would be investigating. No details of that investigation have been made public. Did it occur?
Again, investigations would not happen at a provincial level or a ministry level. They would be the purview of and the responsibility of either local police departments, or in some cases they would refer it to another division, another police operation. So I'm sorry, I can't give you any more clarity on that. There was no Solicitor General-led investigation, nor would there ever be, frankly. Thank you.
Next question.
Your next question comes from Adrian Gabriel with City News. Please go ahead.
Hi, good afternoon. Question for Minister Elliott. Thanks for taking my question. You mentioned that we're actively working on a plan right now for the 12-plus age group following Health Canada's announcement today. Would the plan include looking at making sure that students have access to a vaccine so that they're fully vaccinated ahead of a September return to school? And in turn, is there a plan in place to accelerate teachers to get their doses of their vaccine, especially to their second dose, ahead of a September start to school, which experts say is pretty much key to keeping schools open in September?
Well, thank you for your question, and I would say yes to both. With the recent announcement that the Pfizer vaccine is available to students who are between 12 and 16 years of age, the plan would be to start the vaccinations in schools, the first dose, and then have the second dose administered before a return to school date in September. Similarly with teachers, we have already prioritized school workers to receive the first vaccine, and so just by virtue of time, then the second dose would be needed before September as well, with that 4-month interval.
Follow up.
A question for my colleague, Cynthia Mulligan. Is there any consideration to extending the 2-week period diverting 50% of vaccines to hotspots, to extending that maybe to 3 weeks or 4 weeks?
No, that we have been advised by the medical experts that it's really important to get these vaccines into the hotspots as quickly as possible. And with the supply of vaccines in the locations in which they can be dispersed and people can be immunized, the 2-week period should be sufficient to bring transmission more under control in these hotspot areas, and then we will use the 100% of the vaccines to be distributed across the entire province based on population and risk as well.
Next question, and this will be our final reporter.
Your final question comes from Graham Richardson with CTV Ottawa. Please go ahead.
Hi there. Could you tell me how many pharmacies are involved in the Ottawa area with this new plan for Moderna?
So again, we will definitely get you that information. I don't have it off the top of my head. My apologies. Today has been a series of good news announcements. When we heard Health Canada lowering the age eligibility for Pfizer, when we hear the increased supply, but I have to reinforce that this is not just about vaccinating as many people as possible, as quickly as possible. We also have a responsibility to ensure that the variants are not coming in to Canada and Ontario. And we will continue to pressure, as you know, Minister Elliott and I have written a number of letters to our federal counterparts asking, pleading that they do more at the border, particularly related to land border crossings. And we will continue that pressure because we need, while we continue to have some excellent news on the vaccine rollout, we also need to protect our borders in a better way. It's why we've done the temporary foreign workers. As soon as they arrive in Ontario, we offer them access to a vaccine, and we would like the federal government, frankly, to do more testing and step up and get that done too, so that more of us can be protected and safe. Thank you.
Follow up, and this will be our final question.
Your government keeps mentioning the border now, and talking about 150,000 people who have come across the border in a given period of time. How many of those people are Canadian citizens? Is the Ontario government telling and asking the federal government to refuse entry for Canadian citizens who are returning, which obviously has constitutional complications? And when you talk about infections that have come from away, like they've walked across the border, that is, with respect, a very simplistic analysis of a very complicated situation. How many of those cases that have walked across the border, your words, not mine, your Premier's words, not mine, walked across from a Canadian citizen who has a constitutional right to re-enter the country?
So to be clear, we are not asking the federal government to refuse people. What we are asking is that they test every individual to make sure that they are not carrying COVID or a variant. It's a very simple ask. 3 days to do the test immediately, whether it is a domestic traveler or an international traveler. We started that in Ontario with Premier Ford's leadership at the beginning of the year. And to their credit, the federal government did step up and are now testing all incoming international visitors. We can do the same with domestic travelers. And it is absolutely understood that the variants that are on Ontario soil came and were discovered in other countries first. So I am going to keep talking about this. We are going to keep pressing our federal cousins to do this because at the end of the day, it will save lives. Thank you.
Thank you.